All right, so I would like to welcome our guest for today. She teaches dermatology. She's also a clinical professor at TUSPM. She is known as the Queen of Warts, and she is also the author of the book called Skin Disease of the Lower Extremity. Welcome, Dr. Vlahovic.
Thank you. Thanks for having me.
I want to thank you for joining me on this discussion today for why podiatry. I think with your knowledge, your expertise, and your passion for the field of podiatry, I hope that it can help inspire students who are considering this field.
Absolutely.
All right, so without further ado, let's get started. What made you lean towards pursuing podiatry?
Well, I have been a dancer my whole life, and I wanted to find something that melded my interests. And it was interesting when I was in college. I said, I wish there was a book that would just fall out of the sky and tell me what to do with my life. And I was nosing around in the library stacks, and I found a book called Medical Problems of Performing Artists. And there was a whole section on dance, and there was an article written by orthopedics and podiatrists. And I was like, this is it. This is perfect. I hadn't thought about it. I had gone to a podiatrist when I was a young dancer, and I just didn't think about it. And then all of a sudden it was like the light just went on over my head, and that was it. So I pursued it, and podiatry was the only thing that I applied for, because it just made sense with my history of dance and my history of being a science major. It made sense for me.
Mm-hmm. So what kind of education and training do podiatry students go through?
So it's a 4-year program, and the first 2 years are generally didactic, and the last 2 years are mostly clinical. It is rigorous because you not only have to learn about the whole body, but then you have to go back and focus on the lower extremity. So for instance, there's a general anatomy class, and then there's lower extremity anatomy class. And you certainly with dermatology, I try to teach the whole body and then focus in on what mostly happens to the lower extremity. So it's something that you really have to know a lot of what's going on. It's not just focused on the lower extremity. You have to know everything that's going on in the body, because everything can affect the feet.
Mm-hmm.
And following podiatric medical school, generally people go into either a 3-year residency, or there are 2 4-year residencies. The 3-year residencies are more surgically based. These are, you're in the hospital, you're doing surgery every day, you're seeing patients in the clinic, you're seeing patients on the hospital floors, to prepare you to ultimately go into private practice, where you have certainly a different day than when you are in residency, meaning you're going to be seeing patients in the office mostly with, a day or a day and a half of surgery that you might be doing at an outside site.
Okay. So before I shadowed any podiatrists, I kind of fell victim to this singular way of thinking that podiatry meant just treating toenails. Can you elucidate on this misconception and why podiatry is a more exciting career than this?
Well, first of all, I love toenails, right? I mean, I'm someone who treats toenail disease, we'll say. Okay, so toenail disease is fascinating. Toenails can tell you a lot about your health. But I think the misconception that podiatric physicians just treated toenails came because for many, many years, podiatry began as something called chiropody, where it was primarily more of a primary care situation, that they were taking care of nails and doing some biomechanical things. And there is absolutely nothing wrong with that. It has evolved over time into, again, something, a career that encompasses dermatology, which is what I do so much. So again, nails and skin are so important, really are. Vascular, because if you don't have vascularity to your lower extremity, you're not going to be able to heal wounds. So we have to work closely with that. And also with dermatology, wounds and the things that we see so much with our patients with diabetes. Orthopedics, there's so much more that we can do now. Of course, we take care of sprains, strains, fractures, but from both orthotic and prosthetic component and shoes, which have evolved so much, as well as from a surgical standpoint, that orthopedic standpoint. We have so much more that we are able to do. In the last few years with the ankle implants, and with one of my classmates does limb lengthening and things like that. So there's just a really huge range of possibility of things that a podiatrist can do if they're trained to do that and want to do that.
Cool. So after 4 years of podiatry program and 3 or 4 years of residency, is there any specialties that any podiatrist can go into?
So there's something called a fellowship that can be completed after that. So podiatry isn't so much, podiatry is a specialty already. So it's very much a specialty. So
Right.
what I'm doing is more of a subspecialty, and I have more of a unique situation. In private practice, it would be much more difficult to do that. But there are some podiatric physicians that choose to do more reconstruction, so surgical reconstruction, some who choose to do more diabetic limb salvage, some who choose to do a lot of sports medicine, and they'll work with various sports teams and things like that. So there are some avenues that can go into. There's also fellowships that provide more of a focus on surgery, whether it's again, more of a limb salvage situation, or just general surgical techniques. But there are things that you can focus on, we'll say, in a fellowship, and then how you choose to do that in your own private practice is entirely up to that person. So.
Okay. So you alluded to fellowship. My next question is, you're actually the first podiatrist to get into a dermatology fellowship. Can you explain what exactly is a fellowship, and why do you think you were the first ever to consider pursuing this fellowship?
Well, a fellowship is something that's very common in the medical world. It's done after you've done your initial residency training, and it's again to focus on a particular field. So what happened with me is I was in the midst of my surgical residency at St. Luke's University Hospital Network in Allentown and Bethlehem, Pennsylvania. And I had a rotation with a dermatologist, which not all residencies have a dermatology rotation. And I loved it. I really loved the experience. I loved that time, and I really wanted to learn more. So I kept in touch with that attending, and then I spoke with my residency director, who decided that if I really wanted to pursue something in dermatology, that they would actually create this fellowship for me. So the reason why I'm the first is because they actually created the program for me.
Mhm.
It still exists to this day. Why nobody had done it before? Well, it's a lot of work to create a fellowship. You need a residency director and a hospital that's on board. You need people, attendings that are willing to train you. So I had a dermatologist who was willing to train me. I had a residency director who was willing to put the work in to create all the paperwork that's needed for a fellowship. And then I had a hospital system that was willing to also put the work in. So it was just being at the right place at the right time. But it was an incredible experience. It was a whole year, and because I was the first one through, I certainly had my base months in dermatology, but then I had some extra months where I did a month of endocrinology, I did a second month of plastics. So there were things I could pursue, but the dermatology, my time in the dermatologist's office was pretty incredible, because he would see over 200 patients a day.
Wow.
And now I wouldn't see 200 patients, but I would see a lot. He was booked with so many patients every 15 minutes. It was incredible. So I saw everything, absolutely everything. And he had more of a medical than cosmetics. So there was some cosmetics, but a lot of medical dermatology. So that's why I'm able to teach dermatology at Temple, because I've seen so much.
Mhm. Okay, so having completed the dermatology fellowship, does that impact on the patients you see or the way you practice medicine?
Absolutely. So again, as an academic, I have the ability to be more in a subspecialty. So certainly I'll see the regular podiatric patients at Temple, but I would say 95 or even 98% lower extremity skin conditions, whether that is a wart, a nail issue, a rash, a wound, something like that. So it's what I'm known for. It's what people send their patients to me to see, and I love it. Like, give me the most ridiculous, most complicated skin cases, and I'm a happy girl.
Okay. And for those who choose not to, do a fellowship,
Mhm.
what are those podiatrists going to see on a daily basis?
Oh gosh, well, I think one of the most common things that we see are a lot of orthopedic traumas, injuries. So, like plantar fasciitis, Achilles tendonitis, various tendon strains and sprains, ankle sprains. Um, a, a lot of ingrown toenails, which are fun procedures to do, I personally think. But also, what we call diabetic foot care. So, where we're seeing our patients who have diabetes, we're examining their feet, we're making sure that there's nothing open, that there's no wounds, that there's no anything that could be labeled as pre-ulcerative, meaning that something that could become an ulcer down the line. We're trimming their toenails or debriding their toenails, because oftentimes these patients either can't see because of diabetic retinopathy, they can't bend over because of arthritis or various back issues, and they can't feel because of the neuropathy. So that means that they lose the sensation in their toes and fingers. So it's actually a service that we're providing to them to keep their feet healthy and safe. So that's something that the average doc is going to see. They're going to see also patients who have, again, other orthopedic complaints like arthritis and bunion pain, and things like that. So they might have to make orthotics. They might have to recommend shoe gear, watch how people walk to see where the painful pathology is coming from.
Hmm. Um, Also, can you explain what's a day like for you before the COVID?
Well, my days are different than somebody in private practice, because first of all, when my day starts, it's like a slingshot. It doesn't end. But it's because I'm seeing so many different kinds of, usually again, patients with skin conditions, lower extremity skin conditions. So it's just going, going, going. I also have a unique situation that I'm working with students and residents. So the students are with me the whole time. So that makes it a unique situation. And so my day is seeing patients, and then some days I'm teaching class, and then some days I'm doing research. So I do a lot of clinical research. So my days are kind of split between seeing patients and either teaching or doing clinical research or writing. So I do a lot of writing. So it's a lot of different things that an academic doc would do.
Hmm. You contribute a lot to the podiatry profession. You write articles, you do peer reviews, you write books. And one thing that in particular I want to bring up is that you bring this special treatment, the Marigold, for treating plantar warts. Can you tell me what is your motivation behind offering this treatment to our patients?
So the funny story is that I met the doctor, the son of the doctor who created it. So I met his son at a wound care convention
Hmm.
in Vegas, and I was reading a poster about Marigold therapy for wounds, and I was like, what? And I just said it out loud. And then I hear behind me a voice that's very much British saying, but of course. And so we started talking and found out we both had a passion for treating warts. So yes, there's another person out there who loves treating warts as much as I do. And I consider him a brother from another mother. And I learned from him. And then I went over to London to his clinic and trained with him. And it just was really such a fascinating, interesting therapy to take something that's natural, that they studied in a lab, and he did his PhD on warts, which makes me love him even more, looking at tissue cultures and how the virus is, how it's affected in these tissue cultures. And so it's a very gentle but effective way of treating of plantar warts. So it's something that just made sense. Like, again, I love treating warts, but I also have a side of me that not only loves Western medicine, but also appreciates non-traditional methods. And that's a range of different things. So the Marigold is a natural therapy, and I really like that. And a lot of my patients appreciate something that is very natural. It's basically Marigold and alcohol. It's a very specific Marigold. You can't go home and just take marigolds from your yard and use it on your feet. It doesn't work that way. But the whole thing is it was just another option. It was a unique option, and certainly it has been a really lovely addition to what I treat patients with, especially those who are looking for that kind of option.
Hmm. And on top of that, you're also the first female fellow at the Royal College of Physicians and Surgeons at Glasgow. It's a prestigious institution created with a desire to advance our profession as well as improving patient care. Could you describe what this organization means to you and what unique experiences have you had from this organization?
So I was the first U.S. female to be one of the fellows of the Faculty of Podiatric Medicine. So this is even though it's based in Glasgow, it's an international organization. So when I went in for the initiation or induction ceremony to Scotland, it was a really amazing experience to meet podiatrists from all over the world who were being inducted as well, and to know that I'm part of that organization. And the history of it is just really special. And there's so much, in Scotland, there's so much history of medicine there that it's very meaningful to me. So they are they're great about keeping up with all the news and the information and trying to disseminate that across the world. So it's just really special to be part of an organization that has so much history and that has so much connection around the world.
Okay. And before we conclude, do you have any closing remarks for prospective students?
Well, anything in medicine has its challenges. So, whether it's applying or sometimes when you're in school, it's sometimes really difficult to see the forest through the trees, as they say. Meaning, you can get caught up in the whole process of studying and trying to get this grade and this grade and this grade. And I can tell you, as someone being on the other side, I think about all the stress I used to have about a pharmacology exam, and I think, why did I do that? Why did I put that much stress on myself? Granted, I wanted to do well, and that's something you want to do, but realize that the ultimate end game with this is to treat patients.
Mhm.
So you want to focus on learning so that you can be the best physician that you can be. It's not about just taking that test and trying to get 100 on it. It's about learning and really assimilating that information so that you can provide the best care for those patients. And that's what you want to remember is ultimately it's your job to help these people. And a lot of those elements in school, especially the clinical classes, you will be using every day.
Mhm.
So it's something that it might be difficult to keep in mind sometimes because you just get caught up in it all.
Mhm.
But the reality is you put all that work in the front, meaning school and residency, so that you can be the best physician for your patients.
Okay. And last words for students in college who are still, deciding whether podiatry is right for them.
Well, one of the things I love about being a podiatrist is that it's very hands-on.
Mhm.
I love that I can do procedures. I love that I can also speak to my patients. So, we call it verbal anesthesia for giving somebody an injection prior to doing something. Like we can, talk to them, calm them down. But also, over time, we get to know about their families and their trips and their jobs and their life, and it's a nice relationship to have. So it's really that we see these patients often periodically. We get to know their world. We get to be part of their world. And I just have the best patients in the world. I really do. Like my patients are just fantastic. So it's an honor to be part of their care. It's also something that, again, I feel like I've done something for these patients when I've done whatever I need to do, whether it's prescribing something or doing a procedure, I feel like I've done something to hopefully impact them positively.
Mhm.
So it's a profession that has something for everybody. And if you're somebody who does like to use your hands and have that spatial relationship, meaning that you think about physics, and that translates into biomechanics and orthopedics and things like that, which is so much of what we do, then this is something that can be really, really good for you. But also somebody who really likes just being with people,
Right,
because
right.
you
Hmm.
really have to be able to hold a conversation with somebody, no matter what you're doing. So it has a lot of aspects to it.
Yeah. So it's more than just cutting toenails. It's a lot of wound care. It's dermatology. It's ortho. It's vascular. It's neuro.
Yeah,
It's
it's everything.
it's all encompassing.
It really is. It's all encompassing. Now, granted, we can't do the vascular surgery, but
Mhm.
we have to recognize the disease state and know and have a collaboration with vascular surgeons so we can get those patients help so that they can heal. So it's a matter of just, again, taking all that we've learned, recognizing it, managing it, getting them to the right people, and then coming back to us for the things that we need to do, like say with a wound to heal it. We have to make sure they have the blood supply to heal that wound in order for them, to have a successful result.
Yeah. All right. So I think that concludes our questioning, and I hope that by you sharing your knowledge, people get a glimpse of what podiatry is like in the eyes of a practicing podiatrist. And I want to thank you today for doing this interview. I also want to thank you for continuing doing your research, writing papers, educating even current podiatrists right now. Um, on dermatology related topics, and you're just like propelling podiatry forward, and I really appreciate that.
Oh, thank you. I appreciate it.
Hmm. All right, see you later.
All right. Thanks.